I'm Dr. Peter McCullough, president of the McCullough Foundation, and on behalf of Vice President John Leake, Administrator and Epidemiologist Nicolas Hulscher, and our entire board of directors, I want to wish you a very happy Thanksgiving. Here at the McCullough Foundation, we have so much to be thankful for. First and foremost is our gratitude for your generous donations, as well as your intellectual and moral support for our work. Your donations and our growing endowment allows us to fully operate the four pillars of the foundation. First and foremost is investigative scholarship and our peer-reviewed publications, our print publications. Number two is our media and a very important news commentary function that the foundation does. Here we educate the public, we educate other doctors, so many out there seeking the truth. Number three is justice and our work in the courts, our work in terms of legal review and aiding and assisting all of those who have been injured and harmed through the course of this great controversy that we're in. And then finally, number four is public policy. And boy, have we made a big impact there. Going from our 2024 annual report now to our 2025 annual report, our cumulative accomplishments are, continue to grow. You remember the McCullough Protocol for Early Treatment of COVID-19. That was the first peer-reviewed, published, widely adopted, Physician Association adopted treatment protocol for early acute COVID-19. So it's been credited with saving tens of millions of lives and sparing hundreds of millions of hospitalizations. We didn't stop there. Next came McCullough Protocol, base spike protein detoxification, which was the first scientifically supported approach to helping people remove the SARS-CoV-2 spike protein in the body, loaded to the body, into the body by SARS-CoV-2 infection, but as well as COVID-19 vaccination. It's a mainstay now for the treatment of long COVID and vaccine injury syndromes. Our investigations have continued. We have now dozens of peer-reviewed publications concerning the pandemic, and most recently, our very, very important work that is undergoing peer review right now, but it was published on the European Commission Open Air Zenodo server, and that is the McCullough Foundation report on the determinants of autism spectrum disorder. This is the most comprehensive assembly of data concerning the epidemiology of the etiologic determinants of autism spectrum disorder, recognizing we're in a chronic disease epidemic of autism. It's been widely viewed at the time of this recording, has had over 200,000 reads and downloads from the European Commission server. It's been widely presented in the independent and mainstream media. And we believe it was a central driver for the CDC to, about 3 weeks after the release of our report, to change its stance on routine childhood vaccines and autism spectrum disorder. And the CDC and HHS has indicated they'll do their own report. And at the McCullough Foundation, we've encouraged them to do so. In fact, they're overdue in generating a report. With the CDC has had decades to work on this. Americans want to know, where is all of this autism coming from? 1 in 10,000 when I was a child to now 1 in 31, fully 3.2% of the entire childhood population affected by this disorder. And then in a penumbra of associated post-encephalitic disorders, including attention deficit hyperactivity disorder, which is over 10%, tics and seizures, this bundle of neuropsychiatric problems is having a grievous impact on our children. At McCullough Foundation, we are in the lead in evidence-based medicine, in our analysis and reporting, and we're fully ready to help the public as well as government agencies move forward on this important investigation. And then very importantly for Thanksgiving and moving into the holiday season, be sure you pick up a copy of our new book, Vaccines, Mythology, Ideology, and Reality. The lead and principal author, John Leake, is the foundation vice president. This is considered to be now in the genre of books regarding vaccines and concerns about them, the leading historical piece on the 300-year development of an ideology, in a sense, a false religion that grew out of fear, irrational exuberance, bold claims, money, and power. And what we've been left with is a delusional structure around the thinking of vaccines, particularly by doctors and healthcare workers, public health officials, and others. It's all here in this book. It's a gripping, 300-year narrative, character-driven, with a beginning, a middle, and an end. Pick up your copy of Vaccines, Mythology, Ideology, and Reality. It's been rewarded as a New York Times best-selling book, and you certainly can make it available to your doctors, people important in your lives, your lawmakers, and very importantly, your family, so everyone can get a better education and insight on the development of vaccines, how this came to be, and where we are now. So in summary, I want to thank you so much, each and every one of you, for your support of the McCullough Foundation. Make sure you follow us all over social media. Visit our website, www.mcculloughfnd.org. Donate generously. Make sure you give us your input on the direction that we can take as an independent, not-for-profit, 501c3 organization. We have no ties to the government. We have testified multiple times in Congress as well as in state houses of legislation, and we stand ready to support you and represent you as you interface with public health, the media, and the biomedical community as large. I'm Dr. Peter McCullough. Again, happy Thanksgiving, and thank you so much for listening.